Are you over 60? Then I have just one question for you this morning. That glass of water you drink right after waking up, is it saving your life or quietly ignoring your risk of stroke? Because the truth is, the morning hours are the most dangerous time of day for your heart. Let me explain, slowly and clearly. After age 60, your blood naturally becomes more viscous, thicker, especially in the early morning. Your body has just spent 6 to 8 hours lying down, not moving. You've lost fluids through breathing, maybe through sweating, and you haven't replenished anything yet. This dehydration leads to increased blood viscosity. In other words, your blood flows more like syrup than water. And that's when the danger begins. According to Harvard Health Publishing, elderly adults have a significantly higher risk of cardiovascular events in the early hours of the day, especially between 6 a.m. and 10 a.m. One study published in the American Heart Association journal revealed that stroke risk increases by 80% during these morning hours compared to other times of the day. Let's pause and think about that number. 80%. If a medication increased your risk of anything by 80%, would you still take it? Then why start your day without addressing this 80% risk? Let's go deeper into the science here, because you deserve to understand exactly why this happens. During the night, your body switches into what researchers call a prothrombotic state. That means your blood is more likely to clot. Your platelet activity increases, your blood vessels constrict, and your fibrinogen levels, that's a protein that helps form clots, go up. Now combine that with sluggish blood flow and dehydration, and what do you get? A perfect storm inside your circulatory system. It's no wonder then that so many older adults report feeling stiff, foggy-headed, or slightly off balance in the morning. That's not just aging, that's thickened blood struggling to circulate through already narrowed arteries. This is especially dangerous if you have other risk factors like high blood pressure, diabetes, or a history of smoking. But here's something most people don't realize. You might be spending money every month on supplements, memory pills, heart vitamins, circulation support, but they may not be reaching the cells that need them most. And it's not the supplement's fault. It's your blood flow. It's your transportation system. As a clinical nutritionist, I've seen this over and over. People come in saying, I've been taking fish oil and CoQ10 for 6 months and feel no difference. And when we look deeper, the real issue is not what they're taking. It's that the nutrients aren't arriving. The highways, your blood vessels, are congested. The delivery trucks, your red blood cells, are stuck in traffic. So before we talk about what to take, we must first open the roads. And believe it or not, that starts with one simple step. What you drink in the first 10 minutes after waking up. Not coffee, not cold juice, just one specific drink. A natural, warming combination that helps hydrate your body, gently thin your blood, and restore flow to every corner of your circulatory system. But we'll get to that in a moment. For now, I want you to hold on to one powerful idea. If your blood can't move, your medicine can't work. If your nutrients can't reach your cells, your body can't heal. And if you're not drinking the right water in the right way at the right time, you may be unintentionally increasing the very risks you're trying to avoid. But here's the good news. This is something you can fix, and the solution is far simpler than you think. In just a moment, I'll walk you through the exact ingredients I recommend for your morning drink, based on published clinical research. We'll talk about how each one works, how to combine them, and who should be careful. And trust me, the most powerful ingredient is one you probably already have in your kitchen, but that's coming next. And that's where the transformation begins. Now let's open up that morning cup together, because what's inside can either fuel your circulation or slow it down even further. I want to walk you through 3 simple ingredients, each one backed by science, each one chosen to support healthy blood flow, reduce thickness, and gently stimulate your cardiovascular system. Let's count them down, from the most basic to the most powerful. 5. Warm water, the temperature highway. It might sound too simple to be true, but the temperature of the water you drink matters, especially first thing in the morning. When you drink warm water, around 104 degrees Fahrenheit to 113 degrees Fahrenheit, you stimulate gentle vasodilation. That's when your blood vessels expand slightly, allowing for easier blood flow. Research from the Journal of Thermal Biology confirms that warm fluids promote peripheral circulation, especially in older adults. This mild internal warming effect can help wake up your vascular system without shocking it, which is exactly what cold water does. Cold water constricts your vessels. Warm water invites blood to move. So before we even talk about herbs or fruits, we must begin with this base. 1 full cup, 8 to 12 ounces, of warm water. Not hot, not cold. This alone helps begin the unclogging process after a night of stagnation. But we're just getting started. 4. Ginger, nature's vessel relaxer. Ginger is more than a spice, it's a natural circulatory tonic. Studies published in the Journal of Nutrition and Metabolism have shown that ginger has anti-inflammatory, antioxidant, and vasodilating effects. It supports blood flow by relaxing the muscles around your blood vessels and even helping reduce platelet aggregation. That's the clumping of blood cells that can lead to clots. In fact, one clinical review in the International Journal of Preventive Medicine noted that daily intake of ginger helped reduce LDL cholesterol, triglycerides, and blood pressure in older adults. Ginger also contains a compound called gingerol, which acts as a gentle natural blood thinner. It's not as strong as prescription medication, but it can enhance blood fluidity, especially when paired with hydration. How to use it? Take a few slices of fresh ginger root, about the size of your thumb, crush them lightly, and add them to your cup of warm water. Let it steep for 5 to 10 minutes. It'll warm your belly and open your vessels. And for many of my patients, this is the ingredient that finally makes their hands and feet feel warm in the morning again. 3. Lemon, the gentle loosener. Now comes the citrus. A splash of fresh lemon juice in your morning drink doesn't just add flavor, it adds function. Lemon is rich in citrus flavonoids, particularly hesperidin and diosmin, which have been studied for their effects on capillary health, blood viscosity, and venous return. The ability of your blood to return from the legs back to the heart. According to research published in the British Journal of Clinical Pharmacology, citrus flavonoids can improve microcirculation and reduce inflammation in vessel walls, making it easier for blood to pass through tight or narrowed areas. And yes, lemon also supports your liver function, which plays a key role in balancing cholesterol and filtering the blood. Just 1 tablespoon of lemon juice adds enough acidity to stimulate your digestive system and awaken your metabolism without overloading your stomach. But here's a key detail. Don't use bottled lemon juice. It often contains preservatives that reduce its effectiveness. Always choose fresh lemon, squeezed straight into the cup. So now let's pause and bring it all together. You start with warm water to open the highway. You add crushed ginger to relax the vessels, and you finish with lemon to gently loosen the flow. This trio doesn't just hydrate your body, it prepares your blood vessels to transport medicine, nutrients, and oxygen more efficiently. Think of it as your morning tune-up. No pills, no side effects, just flow. And in case you're wondering, yes, this combination is safe for most people. But there are a few important exceptions I'll share with you in the next section, because safety comes first. Before we get there, though, I want to invite you to commit. If this information is helping you understand your body better, if you believe in the power of small daily habits, then I'd like you to do something powerful. Type in the comments, "I agree." That's it, just those 2 words. I agree. It's not just a comment, it's your promise to yourself. A small, gentle vow. I'll care for my circulation each morning, and I'll read every single one of those messages. Now, in just a moment, I'll show you the exact recipe, step by step, along with the most common mistakes people make when preparing this drink, like boiling the ginger too long or adding the lemon too early. Even more importantly, we'll talk about who should not use this drink without consulting their doctor, especially those taking blood thinners. Because even natural remedies need to be used wisely. That's all coming next. All right, now that you understand why each ingredient works, let's talk about how to make it right. Because even a healing drink can lose its power if it's made the wrong way. Over the years, I've seen so many people get excited about lemon ginger water, but end up boiling it, sweetening it, or drinking it in a way that actually makes their blood pressure spike or irritates their stomach. So today I want to walk you through the clinically safe, effective method, step by step. And I'll also share who should be careful with this drink, because your safety comes first. Here's how to make the natural morning circulatory drink. Ingredients for one serving. 10 ounces of warm filtered water, not hot, around 110 degrees Fahrenheit is ideal. 3 to 4 thin slices of fresh ginger root, lightly crushed. Juice from 1/4 of a fresh lemon, about 1 tablespoon. Optional, a pinch of Ceylon cinnamon or turmeric. Preparation 1. Heat the water gently until it's warm but not boiling. If it's too hot, it may destroy the citrus enzymes and irritate your stomach lining. 2. Place the crushed ginger in the warm water and let it steep for 5 to 7 minutes. Do not boil the ginger directly. This can over-extract its pungent oils, making the drink too harsh. 3. After steeping, remove the ginger, then add your lemon juice. 4. Stir gently. Sip slowly, ideally within the first 15 minutes of waking up. This drink works best when consumed on an empty stomach. It helps stimulate the vagus nerve, activate digestion, and, as we discussed earlier, support blood flow through gentle vessel dilation and hydration. If you feel warm, alert, and energized within 10 to 15 minutes, that's a good sign. That means your body is responding well to the improved circulation. But here's the part most people skip. Let's talk about the warnings, because while this drink is safe for most, it is not for everyone. You should consult your doctor or pharmacist first if you are taking prescription blood thinners, like warfarin, apixaban, clopidogrel, or aspirin-based regimens. Why? Because ginger and lemon can enhance the effect of these medications, potentially increasing the risk of bleeding. Have gallbladder disease or a history of gallstones. Ginger may increase bile flow, which could aggravate symptoms. Suffer from acid reflux or have sensitive stomach lining. Lemon can be irritating on an empty stomach for some individuals. If this is you, try reducing the amount or drinking it after breakfast. Experience low blood pressure, hypotension, frequently. This drink may lower your pressure slightly in the first hour after consumption. Be cautious if you already wake up feeling dizzy. If any of these apply to you, please don't ignore them. Even natural doesn't always mean safe for everyone. And remember, your pharmacist can often give quick, accurate answers about herbal drug interactions. They're an underused resource. Now let's talk about a few common mistakes I see people make with this drink and how to avoid them. 1. Using bottled lemon juice. Many of these products contain sodium benzoate or artificial flavors. These not only reduce the therapeutic benefits, but can stress your liver over time. Always use fresh lemon. 2. Boiling the ginger in water. Yes, this draws out more flavor, but it also releases gingerols and essential oils in a way that may irritate the gut or become too strong for older adults. Steeping is safer and more stable. 3. Drinking it too fast. Some people gulp it down thinking, faster is better, but rapid intake of warm lemon ginger water can cause lightheadedness or a sudden drop in pressure. Sip it slowly over 5 to 10 minutes. 4. Adding honey or sugar. While a little raw honey can be soothing, adding sugar, especially processed sugars, defeats the anti-inflammatory benefits. If sweetness is needed, use a tiny amount of manuka or raw honey, and only if your blood sugar is well managed. Now, I know that might sound like a lot to remember, but once you get into the habit, it becomes second nature. And this brings me to a powerful idea. You don't need perfection. You just need consistency. Imagine doing this for just 7 days, a single cup, each morning. That's 7 mornings of smoother blood flow. 7 days of better nutrient delivery. 7 quiet moments of honoring your body. And if you've come with me this far, through 11 videos, through hours of learning and understanding, then I want you to write one thing in the comments. I'm still fighting. Because that's what this is. It's not just a drink. It's a gentle, daily act of resistance against decline, against giving up, against the myth that aging means surrender. And I'm with you, every morning, every sip. But we're not done yet, because in the final part of this video, we'll talk about why your health is not just your own. It's a legacy, a gift passed down through action. And I'll also reveal one secret. There's a small point on your foot, just one, that if pressed incorrectly can actually trigger a rise in blood pressure. I'll tell you exactly where it is in a moment. If you've made it to this point in the video, I want to say something that's been on my heart. You're not just taking care of your health, you're taking care of your family's future. See, there's something powerful that happens when a grandparent gets stronger. When your steps feel lighter, when you can walk unassisted, when you sit down and get back up without groaning, your children notice, your grandchildren notice, and they learn something without you saying a word. They learn that aging doesn't mean disappearing, it means adapting, growing, leading. And I want you to know, this morning drink, this small act of self-care, it's part of that leadership. You're not doing this just to avoid pills or surgeries. You're doing it so you can walk into your next years with strength, so you can pick up your grandchild without needing someone to hold you steady, so you can go to the park, not just sit on the bench. Let me ask you, how many more moments with your loved ones would you trade for one more cup of coffee but none of the circulation it gives you? Probably none. So here's my invitation. Not a challenge, not a task, but a health contract, a simple commitment from you to yourself. If you believe your body is still worth investing in, if you believe your circulation deserves care, if you believe that one small ritual every morning can open the highways for health, then go to the comments and write, I agree. Or if you've stayed with this video all the way through, and even through previous ones, say, I'm still fighting. I read every single one. I respond to many. Because to me, those are not just words. They're signs that someone, somewhere, is choosing life over fear, movement over stagnation, legacy over limitation. You see, my job as a clinical nutritionist is not just about telling people what to eat or drink. It's about showing you how nutrients are only half the battle. The other half, it's how your body delivers them. If the highway is blocked, even the best medicine can't arrive. But every morning you make this drink, you're doing more than hydrating. You're clearing the roads. You're opening the gates. You're saying, let the healing begin. Now, before we wrap up, I promised I'd share one last insight, something few people know, but that could be the most important detail for your circulatory health. Hidden risk, the forbidden point on your foot. There is a specific acupressure point located just below the ball of your foot near the base of the big toe that plays a role in reflex stimulation of the cardiovascular system. In traditional Eastern medicine, this point is known for affecting blood pressure. Some massage therapists and even well-meaning caregivers may press this area too deeply, thinking it relieves tension. But here's the truth. For older adults with unstable blood pressure or arterial stiffness, pressing this spot incorrectly can actually raise systolic blood pressure, leading to feelings of tightness in the chest, dizziness, or even arrhythmia in rare cases. That's why in video 12, I'll be walking you through where exactly this point is, why it becomes sensitive with age, how to safely massage your feet without triggering pressure spikes. It's one of the most overlooked dangers in self-care foot massage. And I want to make sure you're fully protected. So don't miss that next video, because one wrong press in the wrong place could undo a lot of your good work. And finally, let's recap what you've learned today. 1. Warm water opens the highway. 2. Ginger relaxes the vessels. 3. Lemon thins the blood and supports liver detox. 4. The recipe done right becomes your morning circulatory tune-up. 5. And your commitment, your why, is what gives this practice power. Remember, your health is not just your burden. It's a gift you pass on through your actions, your choices, and your presence. You are writing a legacy with every step, every sip, every breath. So the next time someone asks you how you stay so active, so present, so full of life, you can smile and say, it starts with a simple cup every morning.